Fine.
right?
Definitely, sir. Yes. Okay.
Yeah. So, very good evening to all my invited doctor. Thank you so much for joining us for the today webinar. And our aim is to be spread awareness about thrivis, which is fatal but can be avoided once appropriate vaccinated. This is initiated from Kerala through the innovation to serve the society and humankind. The topic of the webinar is the novel three-dose G protein vaccine, ultimately key for the compliance. Dear doctor, Thrivis is the world's first novel three-dose anti-rabies vaccine, and with the great pride, we would like to inform you that Thrivis has successfully completed 1 year of the launch, with the more than 40K animal bite victims being vaccinated, and 100% compliance was recorded. And there is no case of adverse reaction was registered. So with this, it is my honor to introduce you to speaker today webinar, Dr. Bisal sir. He is a general physician and practicing more than 10 years in the Harihara. And sir having very rich experience, and he has taken so many animal bird cases. And he has cases there is no adverse reaction observed from the sir side. And moreover, sir has already using our Travis. So I would like to request Dr. Bisal to initiate the talks, and later on we have the question answer session, and all the participants can be dropped the question in the box, and we will have read it out all the question after the presentation. So with this, I am going to hand overing session to Dr. Bisal sir. Sir, please you can share the slide, and it is your now session. Thank you.
Well, thank you for it. Well, I'll start up my.
Just start your video so that our audience can be see sir, like for face also.
Yeah, it's just a slideshow, a simple slideshow. Well, I guess the slides are visible.
No, sir. Your slides are not right. Sir, you didn't share anything.
Well,
Parul ma'am, I think you can share the slide. That will be ideal. So sir, that can be go for that one.
Hello, sir. I need to share the slides.
Yeah, please share, ma'am, because I think there is the network issue.
Okay. I'll share and just let me know when to change the slide. Okay, sir.
Sure. Vishal sir?
Yes, sir. Yeah.
Sir, we have shared the slide from our HO side. You just go for through that one. Okay, sir?
Well, I can change the slide when I want, or
no, sir. You tell me once you want to change the slide. Just let me know. Just say next. I will continue.
Okay. 1 second now. Well, today let's have a discussion about rabies. What actually rabies is, and what are the protocols which are to be followed when, or pre-exposure or post-exposure. Well, ma'am, please change the slide. Initially, we'll have a general talk about what actually rabies is, how it is spread, and what's the mortality rate in the world and in India. Well, rabies is a disease or a group of symptoms which has been characterized whenever a human or an animal is being attacked by a animal or a rodent. Okay, it could be a rodent also sometimes. When there is an active bite, so if the saliva of that animal which has been biting the human or the animal is been infected by the rabies virus, okay, then a dared disease do overcome with that patient, which is called as rabies. Well, globally, it accounts to 59,000 of human deaths. Right? And the bad luck is it's been higher in India. So in India, we come across around 20,000 deaths from the rabies, which is according nearly 60% of the rabies deaths in Asia again. Well, 91% of deaths again in India do occur only in rural areas. Why? We'll see it in the next slides. Ma'am, change it. Well, they say in every 9 minutes, a person dies from rabies. Okay. So what's the current management? So current management, initially when there is post-exposure or when there is an active bite, so again, there are different categorization, category 1, category 2, and category 3. In any type of categorization, any type of bites, usually the first aid is the local wound treatment. Usually, it is said that no wound should be bandaged, only it should be washed with soap, okay, normal soap and water for 15 minutes, so that the viral particles which are there in the wound, that could be washed off to the maximum, so that it could not enter into the systemic organization. Right? So next, after first aid, then comes the active vaccine, which is normal protocol nowadays. So vaccine, there are again four vaccine or 5 vaccine. Usually 5 vaccine is been documented by WHO, which says each vaccine or post-exposure, there should be 5 IM doses of vaccine. This is intramuscular vaccination to be given in deltoid, intradeltoid, or anterolateral part of the thigh, and never gluteal region should be used for this type of vaccine. Fine. And usually vaccine is given on the day 1, that is post-exposure, in category 2 and category 3 after wound toileting. So vaccination is done on day 0, day 3, day 7, day 14, and day 28. So that is the actual protocol which has been which is according to national guidelines for rabies prophylaxis post exposure. Then if there is category 3 exposure, so usually passive immunization, that is rabies immunoglobulin, is been administered to such patients. Next. So what are the current challenges of post-exposure prophylaxis nowadays? Is non-compliance. Usually there are with one or the other reason there could be dropout. So a patient who's been exposed to the rabies virus will not compile to the normal protocol of the vaccine. Second is that the current vaccine or the current rabies vaccine which we're getting is CCV, that is cell culture vaccine. Again, it's there are it's an inactivated vaccine which is of older technology, like they say the more than 50 years of technology. So usually these vaccines are inconsistency in potency. They have been low potency, stability. So a clear cold chain is very much important or required for transportation. Availability, most of the time there is a short supply of such vaccine, and sometimes most of the time adverse events. Right. So next, ma'am. So when talking about compliance, what could be a compliant? A compliant patient or a compliant patient is a patient who has been received the full course of ARV, that is on 0, 3, 7, 14, and 28 according to the scheduled number, and that according to that particular date only. If the patient has been taken the vaccine, then such patient is been said as compliant. Delayed compliant is a category wherein the patient will be completing the scheduled dose within 60 days. So he has to complete it within 28 days, but he will be completing the same vaccination schedule in 60 days. So there is a deviation from the schedule. Dropout or non-compliant is a category of patient who will be taken or who will have been taken at least a single dose of vaccine ARV and not completed the complete dose. So they come under dropout or non-compliant. Right? Next. So post-exposure prophylaxis usually a routine practice in view of new centers of for disease control and prevention and World Health Organization recommendations are a retrospective analysis done at clinic, travel clinic. So 110 patients were given a 4 dose of PEP, post-exposure prophylaxis of ARV. So the shortcome in these patients were there was late initiation of rabies PEP in travelers, because it is said that it should be given within a stipulated time of exposure. So that exposure time would have been increased when a patient would have received the first dose of vaccine. Secondly, there could be a need for the administration of human rabies immunoglobulin, that is HRIG. Well, even despite all this, the antibody levels of the rabies antibodies in the body were less than 0.5 international unit per ml in 6 of 90 patients, means that 6.7% after 4 disease. So patient who did not receive optimal rabies post-exposure prophylaxis under the real life condition, there would be significant proportion of patients did not develop adequate antibodies despite all this. Okay, if they have received the complete dose for PEP along with immunoglobulins also, the antibodies in such patients were a bit low. So next one. Change the slide, please. Well, so this were the cause of death. Right? So there are 3 cases studied here. The first is of a female aged 58, wherein she had a street dog bite, which was killed soon. So she received 3 doses of purified chick embryo cell vaccine, that is Rabipur 0, 3, and 7. So no rabies immunoglobulin were given. And that dog bite was categorized under category 3. It was at the right side of the nose. 20 days after the bite, she developed paresthesia, that is half-sided weakness in her face. And 20 days later, she developed fever and restlessness for 5 days, altered sensorium on 1 day. So her CSF findings had a total cells of 5, monomorph 100%, protein 126, sugar 71. So usually it would be like nearly more than 150. So again, the staining was negative. Diagnosis considered was rabies encephalitis. Okay. So confirmatory test, rising serum and CSF virus neutralizing antibody titer 1:8192 and 1:2048 respectively after 5 days of previous sample. MRI findings were bilateral brainstem mild hyperintensities without any restricted diffusion or contrast enhancement on day 2. So treatment was like modified MIL1K protocol from day 1. Hospital survival was of 16 days, but the patient died 1 day due to after 1 day due to LAM. So the second case was a male of 38 years who had a street dog bite. Status of that dog unknown. So again, he received 3 doses of vaccine 037. Again, it was categorized under category 3. He had a bite on the left mid calf, and after 15 days, he started dysphagia, the complaints of symptoms of dysphagia and restlessness. CSF finding not done. Well, the non-compliance of post-exposure prophylaxis among animal bite patients, where a study was conducted at Safdarjung Hospital, New Delhi, wherein they had 316 animal bite patients. So 53% were non-compliant to the full course of ARV, and the reason mainly was next man. So here you can see. So day 1 there was 100% 100% the rate of vaccination. Day 2, that is day 3, it was 88%. Day 7, 85%. Day 14, 70%. Day 28, 28%. So this is again data of municipal corporation hospitals in Bangalore, wherein they had a patients of 215 in number who had a post exposure prophylaxis vaccine. So when 1 dose of rabies vaccine administered intramuscularly on day 0, 3, 7, 14, 28, and also measures were taken to constrain for the compliance to complete the dose. But the compliance rate for intramuscular rabies vaccination was 60%. Next, ma'am. Ma'am, change the slide. change the slide, please. So the major constraint for compilants to complete the ARV schedule was the loss of wages. So it accounts to 47%, forgotten dates 18, cost incurred 13%, distance of the hospital 11%, interferes with school timing 11%. So these were the reasons for the non-compliance of the normal protocol of ARV. Next. So I would like to tell about the evolution of rabies vaccine. So in 1885, live attenuated vaccine. So non-standardized dried preparation up to 31 injection of increasing immunogenicity was given. So that was the normal protocol in those days. 1911 inactivated vaccine. So minimal neutral content liquid preparation, 14 injection each 0.5 ml daily. Then in 1976 inactivated vaccines, again cell culture, more than 2.5 international units, standardized immunogenicity localized 5 injections, that is the normal protocol which has been followed now. So 0.5 or 1 ml. So 03 are given on day 0, 3, 7, 14 and 28. Next. So non-compliance lead to evolution of treatment regime, that is from 31 dose to 5 dose, and still the same has been followed. That is the dose of 5 dose which has been so meeting the unmet medical need, introducing a novel vaccine with simple and short regimen. So novel 3-dose recombinant rabies protein vaccine, the first protein subunit vaccine, okay, which has been launched by Cadila, prepared by VLP platform technology. VLP is virus-like particle, just 3 dose in 7 days. Better compliance due to easy to flow regime and less visits. Convenience, ready to use, no reconstitution required. Usually it's the 3-dose vaccine given intramuscularly on the day 0, 3 and 7. So what is VLP technology? So here there will be a native virus and a G protein is difficult to stabilize. So G protein isolation, purified and stabilized by Cadila Pharmaceuticals. Virus-like particles, that is VLPs, are protein complexes, exist as nanoparticles. These VLPs are similar to native virus particles, but they do not contain the viral genome, so they cannot replicate but mimic the viral antigenicity without being pathogenic. So just we are like confusing our body's immune system to develop the rabies antibodies. So they are capable of inducing a strong humoral and cellular immune response. So VLPs designed as vaccines. So study design, 0 to 3 or 037, 3 doses. So that is the percentage of seroprotein. You could see. So clinical study phase 3, safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure or PEP immunization are randomized comparator controlled multicenter phase 3 clinical studies showed the results as next month. So to evaluate immunogenicity and safety of rabies G protein vaccine administered as simulated post-exposure immunization in healthy volunteers. So 037 days regime, 533 subjects with T rabies. So total randomization, total subject 800, randomized comparative controlled multicentric study, randomization 2:1. So two categorization, one with rabies and Rabipure. You could see the efficacy. That's what, like 533 subjects subjected with therapies and 267 subjects subjected to Rabipur. The study results were next slide. Yes. So when you go on to the efficacy, so yes, you could see 97.72 seroprotection in therapies when compared to Rabipur on day 14 and day 42. The results were consistent across different age and genders, observed different 1.52%, which is percentage. So non-inferiority of seroprotection, primary and endpoint day, that is on day 14 and day 42 were met. Test and comparator are identical in seroprotection rate, both on the day 14 and 42. Safety, when coming on to the adverse effect, Rabipur had 17.2, whereas Tevirbis had only 9.9. Local adverse events like localized pain, Rabipur had a higher percentage of it. Redness, or it was like 3.37 of Rabipur and 2.18 in Tevirbis. Swelling 1.87 in Rabipur, that is the reference vaccine, and only 0.75% in Tevirbis. Well, systemic adverse events, fever 1.5%, 1.50, only 0.38. Ear pain 0% in Rabipur, but 0.19% in Tevirbis, a bit higher than Rabipur. Headache, it was again more in Rabipur, 0.75%, whereas 0.38% in Tevirbis. Urticaria 0% in Rabipur, 0.19% in Tevirbis. Joint pain 0.19% in, that is reference vaccine, that is Rabipur, and 0% in Tevirbis. Nausea 0.19% in Rabipur and 0% in Tevirbis. So this was the efficacy with the standard vaccine to that of the newly novel 3 vaccine. Fine. So the conclusions were, so novel 3 dose was non-inferior to reference vaccine. Okay, it had a very good result. That was, and it showed very less adverse effect compared to the reference vaccine. Novel 3 dose was found to be safe, immunogenic, and was comparable to 5 dose of WHO pre-qualified vaccine. Again, it has been awarded the novel 3 vaccine, the Rabies, has been awarded Pharma Innovation of the Year by Economic Times, Golden Globe Tiger Awards, Malaysia for Innovative Product of the Year. Well, that's the end of slide. Any queries?
So thank you, sir, Bishal sir. You are given such excellent, presentation, sir, about the novel 3-dose G protein vaccine. And sir, actually, we have getting a lot of questions from the doctor. One question is coming from the Dr. Binay Hegde, sir. So
Okay.
he's asking you, what is the symptoms of rabies, sir?
Symptoms?
What are the symptoms of rabies? How can he detect it as a rabies?
Okay. Usually, see, initially it is just followed by headache and fever. So that's the thing where most of the time the disease get confused. But later it could be like usually between 4 to 6 days, wherein the patient develops the symptoms of encephalitis, that is severe headache, followed by vomiting, and then altered sensorium, and even hydrophobia. That is the main feature of this rabies. Hydrophobia is where the patient will have or he will get into tremors by just seeing water, or he'll be not able to swallow his saliva. So that is the case wherein the rabies, the vaccine, the virus, it gets propagated very easily in all the organs of the body. I'm not hearing you, sir.
So thank you, sir, for giving sir, for the answer. Second question we are getting Dr. Baswara, sir. He's asking how the importance is to take full course of vaccine, sir.
Yes, pardon?
Sir, Dr. Baswara, sir, asking how important is the take full course of vaccine?
Yeah, it's very important. I just discussed there, wherein when we even by the compliance of the vaccine, we will be getting hardly antibodies. I mean, very minimal antibodies of the rabies, but non-compliance definitely will lead to. Even we had discussed that what case sheets. I mean, a case study of 3 cases wherein due to non-compliance or the patient had received only 3 doses and the patient did not receive immunoglobulins in the category 3 bite, wherein the patient landed up in the rabies symptoms and finally death of the patients.
Thank you, sir. Sir, another question, Dr. Ravi is asking, how is the 3 dose is better than in terms of compliance?
Compliance 3 dose, see what happens first week, definitely a patient will be very active, okay, and he'll be in fear that he might get rabies, so he'll be completing his first 3 vaccines with caution. After that, most of the time what happens, that's what the non-compliance of the virus, vaccine we discussed there was the loss of wages. Usually most of the working class people would just neglect it, okay, or a patient become non-compliant because of losing his wages, okay, and it could be again a mismatch in the school timings, fine. And the third major cause for non-compliance was the proximity of the hospital, or even sometimes the lack of supply of vaccine.
So thank you, Vishal sir. I think we have covered all questions from the doctors, which is coming, sir. And in now there is no question coming, sir. So I think entire doubt is going to be clear from our doctors level.
Right.
So Vishal sir, thank you so much for the informative talk. We truly appreciate your efforts, sir. Last but not the least, we would like to inform you that the Thrivis has won 2 prestige award in the innovation category. First is the Sir Economics Times India Pharma Award, sir, and second is Golden Globe Tiger Awards.
Yes,
So
yes.
with this, sir, thank you so much, sir, for giving the presentation and giving such a talkative information about the dog bite and the management, sir. Thank you so much, sir.
Thank you, sir. Thank you.